about socialism. So we want to talk about it from the standpoint of socialism and its role in providing adequate and quality healthcare, for the people of Cuba. And so we start, as we always do, by giving acknowledgement and respect to the indigenous people of the Western Hemisphere. I got a secret for you. They are fighting for their land back, to reclaim these lands. These lands belong to them. They don't belong to you if you're not native or Indian or indigenous to the Western Hemisphere or Mexicano or Chicano, Puerto Ricano. If none of those identities represent you in a real sense, not just through some fog in your head, then these lands aren't yours. So they are fighting for their lands back, and they will achieve that objective of getting these lands back. And we stand shoulder to shoulder, we sit shoulder to shoulder, we lay shoulder to shoulder with them in their fight to get these lands back. And we also give respect and honor to our African ancestors. And another secret, Africans all over the world are organizing for one unified socialist Africa. You won't see it on CNN and CIA, but it is something that is happening. And like Gil Scott-Heron said, the minute you do see it on TV, you know it's not really real. So we are fighting for this, and we do it in honor of our ancestors, and we are honored to make our contribution. So we give thanks to our ancestors for giving us everything they've given us to carry out this struggle for Africa and African people, which is our contribution to the worldwide movement for justice and forward human progress. So we get started, as we always do, by just acknowledging that Our Ancestors' Voices is a program, again, sponsored by the All African People's Revolutionary Party, the AAPRP. And the AAPRP is a revolutionary, independent, mass Pan-African political party that is based in Africa. We're not the Labor Party, we're not the Democratic Party, we're not the Republican Party, we're not the Libertarian Party, we're none of the capitalist parties. We are an African party, a Pan-African party at that is based in Africa. We are not based in New York or LA or Phoenix, Arizona. We are based in Africa, the national homeland of African people scattered and suffering in 120 countries all over the world. And our work, everything we're doing every day on a daily basis, is designed to achieve Pan-Africanism. Pan-Africanism, which is defined correctly as the total liberation and unification of Africa under scientific socialism, or one unified socialist Africa. You prefer to say it that way, but that is our objective. And we believe that one unified socialist Africa, once achieved, will bring about the fulfillment of the needs of African people everywhere, speaking so many languages, living in so many countries with so many experiences. But all of that is tied into what's happening with our mother, Africa. So that is our work, is to redeem, rebuild, develop, and bring dignity back to our mother, Africa. And in doing so, we bring dignity back to our African people. And we also make a contribution to the worldwide struggle for socialism leading to worldwide communism. That's absolutely right. We didn't stutter. We're not confused. We know exactly what our work is. And so to achieve Pan-Africanism, because that's the stage we're at right now, we have a strategy, and that strategy is outlined clearly in Kwame Nkrumah's Handbook of Revolutionary Warfare. And you should read it, but you shouldn't just read it individually. You should read it as a part of an organized process. That's what we recommend to you. But in that book, the strategy is laid out clearly, and that strategy is to unite all of the revolutionary Pan-African formations on the ground throughout Africa who agree that Pan-Africanism is defined as one unified socialist Africa. And Our Ancestors' Voices is hosted each week by myself, Ajamu, and my biological and ideological daughter, Shakura. Umi is our last name, and we are both active organizers within the All African People's Revolutionary Party. And so without any further ado, our topic women's health in socialist Cuba. I will turn it over to Shakura.
Thank you, kind sir. Appreciate that. All right. So, greetings, everyone. We hope that you are safe and well. We're going to be talking about some really important key health threats that are affecting people of African descent, but also even our comrades of other backgrounds as well. We have some statistics and some data to share with you today. We always like to highlight our African women specifically because they tend to have some of the highest maternal mortality rates, along with other issues that relate to ovarian cancer, breast cancers, things of that nature. But without without acknowledging how much work Cuba has done to reduce those health disparities, I think we would be doing you a great disservice. And so I'm always excited to do this particular presentation because the numbers don't lie. And it's always interesting for people, as my dad pointed out, to talk so badly about Cuba and to say all these things about socialism when really they don't know what it really means. And two, if they really knew what it meant, and if they understood that there is a world that exists, a land, if you will, a country called Cuba, that not only prioritizes people over profit every single day, and they still can function, they still can talk, they still can eat, they still can live a life without capitalism. So it is possible. Okay. That's the first thing. The next thing is Cuba is showing us each and every day that it's possible to live a life without capitalism and to be healthy in the process. And I know that that is absurd for a lot of us to even think about because we can't imagine a world that exists like that. Because in our world, Africans are dying from diabetes and hypertension, and those are just common things that everyone knows. In our world, when you go to neighborhoods where people of color reside more predominantly, you see the signs for dialysis, right? Dialysis centers. You see the signs for selling needles and being able to purchase needles for injections of different things of that sort. You see the signs for kidney disease centers, right? You see these signs, and we also see more liquor stores. We also see more sales for tobacco products and things of that nature. We also are more likely to suffer from other diseases. I think, unfortunately, us and our comrades, our indigenous comrades, share the cirrhosis and alcoholism, and in some cases, their results are even worse than ours. But my point is, we tend to suffer from some really serious health issues, like really, really serious. But if you were to compare those same people, so Africans in Cuba, you would see that the numbers are starkly reduced. And the only denominator that is not common between comparing a country like America to a country like Cuba is A, they operate off of a different economic system, not capitalism, which prioritizes private entities continuingly to profit no matter what, and promoting that profit and protecting their ability to make profit over the lives of humans, no matter what. But then you compare that to the economic system that Cuba does thrive off of, which is socialism. And so in understanding that better, we understand that, okay, if capitalism is about prioritizing private entities to make money at no by any means necessary, by no means, then that means that at the same time, socialism is prioritizing humanity's needs over profit, and instead using humanity, using people's skills, their natural skills that they have, to develop the economic system from a collective standpoint, because it's not about the individual, it's about all of us bringing together what we can do to make the conditions better for all of us. We don't want some of us to have access to these services. We want everyone to have access to these services. And I always like to point out, I really appreciate my work study circle for always having this conversation. But for those of us that are just really ignorant and we really have no idea what socialism is, let us be clear that there are socialist programs that exist in capitalist America right now in 2023, okay? Right now. So if you benefit from taking your dog to the dog park, last time I checked, there's no entrance fee for you to have to pay when you get in the gate to do that. Now, do you pay for those services, for the grass to be cut, for the trash to be emptied, for the poop bags to be replaced? Yes, you do. It's called taxes. Last time I checked, if your house catches on fire right now, which I hope it doesn't, you probably don't have the means to take out a blazing house fire with a 3-bedroom, 2-bath house, but you can call 911 and get patched to the fire department, they are trained to do such a thing. And last time I checked, we don't pay for those services. So I make this argument to say this, you all. Socialism is not the monster that capitalist media wants to make you think it is. It's actually a system that helps every single person benefit and thrive from a standpoint where we all can have resources that we can equally share and use collectively, because all of us need fire department services at some point. All of us will need emergency medical EMT services at one point. All of us may need to go to the park because our children want to play on the swing sets, and we shouldn't have to pay to take them to the park to do that. We should be able to move to a neighborhood where there's a very nice park, where the grass is cut on a frequent basis, where the trash cans are emptied, where we can be able to use the services and enjoy a nice afternoon with our children on the swing set, or our dogs going to the dog park, because that's what socialism is all about. Us using our skill sets as human beings, coming together and using our skills to share with other people, so other people can benefit from what we bring to the table, and we humbly can benefit from what they bring to the table. And so we think more about that and think about how Mariela Castro has done an amazing job, specifically because they are deemed the director of sex education, but the intentionality behind teaching our youth in Cuba about sexually transmitted diseases. I mean, Mariela has done so much work in terms of helping to raise literacy levels around education, okay, about sexually transmitted diseases, sexually transmitted infections, as well as helping to reduce some of the more deadly ones that we're going to talk about in just a second, i.e. HIV. And so just keeping in mind that since 1959, Cuba has had the intentionality of making sure that people have as balanced of a ratio as possible when it comes to seeing healthcare providers. And what we mean by that is you have to understand that there are 500 polyclinics in the country of Cuba. And that means these people have literally done the math, you all, and researched what the measurement would be per 500 people, excuse me, per 30,000 people. And so there are 500 polyclinics for every 30,000 people. And as the people grow and the numbers grow, they build more clinics, because they're trying to make sure that we don't have a situation where you and I might go to a clinic because maybe we had a barbecue accident, or maybe we had a car accident, and then we are being turned away because they don't have medical providers that can see us, which is brilliant if you think about it, because the last thing you want to do is spend 6 hours in the emergency room waiting when there's blood gushing out of your shoulder, or when there is blood gushing out of your neck. Or maybe you go to the emergency room because you have blood gushing out of your neck and you don't have to wait, but instead you get to go first because you're clearly a higher medical priority than the person who's been sitting there because they're having neck pain and we can't really figure out why. And so just understanding more of what that looks like. I also think it's important to note that we talk so much in health communication and in public health about people going to the emergency room for services that really could be better suited if they had primary care physicians, or if they had another type of provider that they could go see. But instead, you have so many people who don't have access to health insurance because they can't afford it, because they have jobs that don't provide it, like the job that I do as a graduate instructor. And so because of that, we have people that are going to the emergency room because where else are they going to go when they need services and care and treatment? But Cuba has found a way to address that. Not only do they have a smaller ratio so you can get the help you need, because for every 30,000 people, there is one doctor and one nurse, excuse me, for every 60 Cubans. And so just breaking that down. So we have 500 polyclinics for every 30,000 people. And then for every 60 Cubans, there is one doctor and one nurse. Can you imagine? Can you imagine not having to wait? And can you imagine having a person that you can go see so that you don't necessarily need to go to the emergency room, which means people who really have emergencies can be prioritized on a higher level. Next slide, please. All right, so I want to highlight for you all, we're going to start off by talking about cancer comparisons, right? And so I pulled from a couple of different sources here, but the three most common types of cancer that affect women are lung, breast, and colon. And in 2019, the Cuban Society of Cardiology established the Cuban chapter of cardio-oncology, including representatives of different subspecialties in cardiology, and encouraging associate memberships of oncologists and hematologists and oncologists. So this society Cuban Society of Cardiology, established in 2019, has been working towards reducing lung, breast, and colon cancer rates for Cuban women. And so additionally, there are more efforts that are being used to reduce the onset of cancer. They're not just working on addressing the current cancer rates, but they're also trying to encourage some preventative approaches so that people don't develop cancerous cells in the first place. And so they've established the cardio oncology groups in all provinces of the country, which is brilliant to me because, again, people who may not have access to drive all the way across one city or one part of the country shouldn't have to go as far because now there are oncology groups in all the provinces in the country. They're using interventional methods to treat cancer patients with the pericardinal infusion, okay, effusion, excuse me. And then they're using local and anti-plastic drugs and pericardiotensis as a therapeutic option in pericardial effusion secondary to neoplastic disease. So this is not my background, so I can't explain this too much, but I think it's important to note that they're making these efforts to help reduce the onset of cancerous cells, and more importantly, to help people manage it who currently are diagnosed as having cancer. I think that's really critical in thinking about that. And I wasn't able to pull, oh yeah, I did. There we go. I was going to say, so if we compare the cancer onset in the US, for example, we have an estimated new cancer diagnosis for every 276,480, okay, 276,480, excuse me, or 15.3%. And if you compare that to the Cuban country, the numbers are starkly different because breast cancer, colon cancer, and lung cancer alone have all reduced tremendously. Why? Because of the creation of the cancer group that I just told you about as of 2019. And so the US cancer rates for 2019 were lower, but they've increased over time. Whereas I'm seeing a pattern with all of the diseases that I'm going to talk about today. The numbers for Cuba also started high, but they have gone down, whereas the numbers for the US have started lower and gone up and increased over time. And so we can move to the next slide and continue on with that conversation. And I should remind you all, please don't forget to donate to abetterworld.me for our raising of funds for African Liberation Day. Again, you see the link at the top, www.abetterworld.me. We are raising money for African Liberation Day, and it is coming quickly, you all. We are less than a month away from our major, major holiday that we celebrate within the All African People's Revolutionary Party. And so we ask you to take that seriously. If you've already donated, we thank you so much. Thank you, thank you, thank you so much. And we ask that you consider donating again. And if you have not already been able to donate, please do. Please do. The money that you're donating contributes to translator fees. It contributes to speaker honorariums. It contributes to some of our comrades who don't necessarily have the same kind of financial support or resources to be able to travel across the continent so that they can get to in-person ALD events because their particular country may not be hosting one. And so again, we ask for your donations so that we can continue to do this work literally on the ground, but also our international virtual broadcast is a huge opportunity for people all over the world to join, and it is very expensive for us to put that on each year. So please, 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 please donate. www.abetterworld.me. All right. So with that, I wanted to talk about something a little bit different that is not necessarily a health disease, if you will, but it does affect your ability to be healthy. So I created this slide for literacy because I think that when we think about being healthy, making choices that are, quote, healthy, finding ways to prevent getting sick, all of that stuff, that means that we have to be able to do what we in health communication call having high health literacy, right? So being able to read, being able to write, being able to compute simple equations where you might have to measure out your food if you're trying to make sure that you're not overeating. Or if you are able to read and write, then that means you can read the prescription bottles for your pills and be able to take the right amount. If you need to write something, maybe you have to email your provider about a question that you have or something. So that means being able to spell, that means being able to type, that means being able to use a typewriter or a keyboard or whatever function you have to be able to send those kind of messages. And for a lot of our people, just like we don't have passports, we don't have the literacy levels to be able to do those kind of things. This is often why health literacy is correlated with lower health outcomes, because if we can't read, if we can't write, if we can't calculate and compute, then how are we going to know how much medicine to take? How are we going to know how to measure out the right portion of food so that we don't overeat if we have diabetes or if we have the potentiality of obesity? How are we going to be able to do those things? And if we didn't finish school because we had bad situations that caused us to drop out or what the case may be, then that just makes it even harder for us. Not to mention the education system in the US is a joke. So the literacy comparisons is really critical, you all, because Cuba created a program called Yes, I Can, which focuses on literacy improvements and enhancements. And more specifically, they focus on reading skills and writing skills. Again, I stress to you that if more people knew how to read and write, I guarantee you that the numbers from a health statistics standpoint would be very lower and very different. Because as I said, that contributes greatly to people's abilities to make the decisions that they make. The Yes, I Can Cuban literacy method has affected more than 10 million people in over 32 different countries. I mean, Cuba is doing this, y'all. They are doing it. And so they're affecting people in Latin America, as well as the Caribbean, Africa, Oceania, and Europe. And all of these people have learned how to read and write. This program focuses on seeing that the signs of exclusion and discrimination worldwide are usually a attributing factor to people not being able to read and write. And as we know before, if you have low literacy levels or if you are considered illiterate, then people are more likely to treat you badly. They're more likely to make decisions for you or assume that you want to do something in the health field that you may not want to do because you're not even in a space where you can advocate or do your own research to be able to know differently, right? And so all of this comes together in understanding this. And so with the Yes, I Can program, it was designed to teach reading and writing, especially in Latin America, ready to be adapted to different social realities and languages. And this program is highlighted as one of the articles on the Grandma website, GRANMA.org website. So you are more than welcome to check out their website if you'd like to read more about this. But this method of literacy was inspired by the National Literacy Campaign that is also attributed in Cuban culture, which was carried out in the middle of the 20th century. And I highlight this because the Yes, I Can initiative is a result of Cuba's participation and the consultation of other countries' literacy campaigns. And the experience gained was the implementation of Haiti's literacy through their radio program. I also want to highlight that this program is 20 years old as of this year because it was established 20 years ago. And the most important piece, well, how do we know that the program is working? We know that it's working because it has reduced illiteracy levels by 4% since the onset of it 20 years ago. And again, in 2003, at the request of the commander-in-chief, Fidel Castro Ruz, the Cuban literacy program, Yes, I Can, was born in the Department of Literacy and Education for Adolescents and Adults of the Pedagogical Institute of Latin America. Now, this Yes, I Can program has reduced illiteracy by 4%. What programs like that exist in the US? I mean, you can barely get your child's teacher to focus on the fact that your child may need extra help. And even if you have a good teacher working with your kid, that doesn't mean that they can give your kid the time that they need to help them really establish strong reading and writing skills, which means you're probably going to have to pay for a tutor on the side. And that's assuming that that tutor actually cares about your kid and wants to help your child learn. Or maybe you may not have the strongest reading and writing skills, and maybe you're trying to find resources and services to support that. How challenging is that for adults to be able to find the support that they need? We all know that people treat you differently if they think that you are not educated. And this is precisely why I created this slide, because we know that that is the case. So if those are the numbers for Cuba, what are the numbers for the US? In 2021, adults in the US were illiterate in reading and writing with 79%. 79% of adults in the US as of last year, 2022, were illiterate in reading and writing. And we know that that can attribute to health outcomes. Next slide, please.
Yes, Shakur, can I just add that in
Yes.
Cuba, they didn't reduce illiteracy by 4%, they reduced it to below 4%.
Thank you.
So
Thank you.
meaning that 96 out of 100 people were functionally able to read and write.
Thank you so much. Thank you very much for that, Daddy. I appreciate that. Okay. All right. So as we continue on, you all remember this slide, probably because I talk about it all the time. But maternal mortality rates continue to be a really big thing for African women. It's definitely a big issue, I would say, across the world globally, but specifically in countries where African lives are not as significant. This is an issue for us. And so if we think about Grandma's website, or even articles that are starting to learn more about the programs that Cuba offers, then I pulled an article from Santana and Espinoza, and they published it in 2018. And they talk about how instrumental this maternal and child health program, the acronym is PAMI for Cuba, how much work they have done to improve the lives of infant mortality and maternal mortality. And so they focus specifically on Cuban women and their babies. And some of the benefits from the PAMI program have been reduction of infant mortality rate by a 5-year survival. So instead of babies dying before their first birthday, they're more likely to live up to 5 years or longer. There is more than 10 prenatal checkups per delivery, which is excellent because that means that there's strong communication between patient and provider, and that checkups for prenatal care are being done and addressed. We have a 5.3% of low birth rates, which is great because that means that folks are not giving birth to babies that are not weighing what they're supposed to weigh when they are full term, instead of them being born premature or being born weighing lower than they're supposed to weigh when they come out of the womb, which is great. And so again, we think about this timeline and what that looks like. So the results that I pulled for Grandma's website highlighted 2017. In 2017, Cuba's maternal mortality rate had dropped to 37.8 per 100,000 live births. Now, keep in mind, that was 2017, and it had dropped to 37.8 per 100,000 live births. In 2018, just the year past that, there were 9 more deaths. So they already improved by 9 people not dying in 2017 than they did the year prior. And so, excuse me, the year prior of 2016, I'm sorry. And so thinking about that in more context, if we know that they're improving deaths each year, then that means their numbers are getting lower in terms of who is dying from maternal mortality. So the data that I'm sharing with you, it is old, yes, because it's based on 2017. But I still want to highlight for you that if we already talked about how there are 60 people for every 2 providers, and we already talked about how there are 500 polyclinics for every 30,000 Cubans, then we know that people have more resources to see providers when they need to. We know that people don't have to wait as long. I just told you that there's more prenatal checkups, and we're doing other things to make sure that people are not dying from maternal mortality rates, which includes making sure that the care is being offered during the prenatal stage, during the antenatal stage, and even during the labor period. And so if we really want to define what is maternal mortality, it's a person giving birth and dying at any point while they're giving birth, while they're pregnant, or even after they have given birth to that child. And so we know that Cuba, their maternal mortality rates are only getting lower, which is great. Now, when we compare that to the US, as I said, the numbers are getting higher. So in 2017, the numbers for the US were 17.3 versus 2022 last year, 32.9 per 100,000 live births. So again, 17.3 in 2017 for US. And then as of last year, it has increased to 32.9 per 100,000 live births. And, also, what does that mean? That means that the US doesn't have adequate patient provider ratios. The US doesn't have an intentional program to reduce maternal mortality. You have people who are talking about it here and there. And you may have a few people doing research on it, but there's not enough people who care about it. If there were, you wouldn't have people dying from it every single day. And some of the people we know about because of their celebrity status, like Kira Johnson having the judge as her mother-in-law, or even Serena Williams and her pregnancy complications. But a lot of these people we don't know about. And that problem is going to continue to grow. Why? Because African women and their children and their lives are not important at all by any means necessary. Whereas Cuba has literally created an intervention program to reduce not just maternal mortality, which is really critical, but also infant mortality, which is also high in the African community. And so we just have to continue to think more about what is the issue with why we're just so against learning more about socialist Cuba when really they have found a way to save lives, literally. And I just, from a public health standpoint, I think they are the best example. And this is why I use them time and time again when I'm teaching these courses for these public health students, because we need to stop letting our ego, I guess, get in the way of our ignorance when really it's like, who is doing a good job of keeping people healthy and alive and safe? Cuba, great. What are they doing and how can we implement it in other parts of the world so that other people can be healthy and safe? It's very simple. It's not complicated. It is very simple. And Cuba understands that. You know why? Because that's why they're bridging out their literacy program to countries in Africa. They sent doctors to Africa when the pandemic first started. They have continued to reach out to Africa and other parts of the world because they don't want to hog their resources. They literally want everybody to be healthy. They're not keeping anything from us. We just are ignorant and we're not doing the research to learn more about how brilliant their programs and their interventions are so that we can take a page out of their book and actually survive to the next year to figure out what's going on. So I am ready to move to the next slide, but I want to remind you all, please make sure you continue to donate to abetterworld.me. Again, donate for African Liberation Day 2023, abetterworld.me. And so as promised, I told you we would talk about STDs, and more specifically, we're going to talk about HIV transmissions. Whew, this is one of my favorite slides to talk about because I think it is incredible what the Cuban country has been able to do. So if you don't know, I strongly don't know how you don't know, but if you don't know, Cuba is the first country to validate the elimination of mother-to-child transmission of HIV/AIDS and congenital syphilis. I will say that again. It is very important that we understand this. There are people who are hating on Cuba right now. They don't want socialism. They're against socialism, blah, 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 blah. But I'll tell you this, if you go to Cuba, you don't have to worry about giving birth to a child that has HIV if you yourself are HIV positive. You know why? Because they have found a way to eliminate it completely. They have also found a way to eliminate congenital syphilis. I don't have to tell you how many children died because their mothers were syphilis positive. And so unfortunately, they were born with syphilis too, or HIV, and it transmitted through them biologically. And now those children had issues growing up, just like their parents did. I mean, how incredible is that they've been able to do that? Also, being able to eliminate the transmission of it means that children can be born in a more, I'll say, less medical and less intervened way. So we're talking vaginal versus some type of intervention where it would need to be cesarean section or even inducing the labor or something like that. So there's a more healthier way of the child being born vaginally because that's more quote unquote normal. And then you and the baby have a chance to communicate on a more natural level if that's the way that your child is born. This also means that if the child does not have to worry about developing syphilis or HIV from the mother, then that means that being able to give human milk is a higher opportunity for that. Because we know that if the mother is HIV positive, then that means the breast milk is going to be impacted or the chest milk is going to be impacted. So if we find a way to eliminate HIV from being transmitted to the child from a birth standpoint, then that means we found a way to address being able to give milk in a different way so that the child can get that milk from the parent. And so I just think that it's really important that we think about how critical that really, really is. I mean, we literally have donated a month to HIV awareness, and we have an HIV Days, World AIDS Day, because it is such a big thing and it kills people every single year, you all. And yet you have Cuba who has access to find a way to share with other people how to not let that be the reality anymore. Just think of how many lives would be saved. Think of how many people are HIV positive right now, and they could benefit from the utilization of resources that Cuba offers. Eliminating HIV transmission helps with access to so many things. And so if we think about the US in comparison, a study by Adamora et al. 2022 said at the end of 2016, adult and adolescent women comprised almost a quarter, or 23.7%, individuals of people diagnosed with living with HIV in the US. And so, of course, the CDC says that it estimates an additional 11% of women with HIV didn't even know that they were positive, because there's at least 11% who were unaware of their infection. Why are women impacted by HIV? Well, there's so many different reasons for that. But again, I stress to you, patient provider ratios have a lot to do with seeking care and getting care. Income has a lot to do with how you can get care. Being able to have a doctor that you can trust, right? Being able to understand that your doctor is going to listen to you and not give you a hard time about what your agency is in terms of you advocating for yourself. We talk all the time about how things are really hard for African people in this world, and they are very hard. But I would argue that suffering from white supremacy is evil within itself, but suffering from patriarchy and white supremacy makes it so much more challenging for you to just go to the doctor's office and say to them, I'm feeling this pain in my uterus, and somebody actually taking you seriously. And there are studies that show that if you don't even have somebody who can listen to you and say, okay, let's do some tests and figure out what's going on, then you're not even in a position where you can be taken seriously. And we know that this is the case if you have a provider who identifies as a male. But there are even some studies that suggest that if your provider is a non-male person, they are still more likely to not listen to you because you are of African descent or of color. And so I think that it's really important that we think more deeply about that, because this is only going to get worse. It's continued to get worse, you all, and we need to continue talking more about this. I want to shout out anyone today who is listening to this seminar and who identifies as a male person, because the conversation does not just need to be had with non-male people. And I know last week on Sunday, my dad said, so if you're a dude, don't just close out your brain, check out and say, oh, that seminar is not for me. We all need to be having this conversation because it affects all of us. Just because you identify as a male and you're not in a position to give birth to a child or pass HIV to your kid, that doesn't mean that this information won't benefit you. It doesn't mean that it doesn't affect other people in your family. It doesn't mean that it doesn't affect the world that you live in. You might want to adopt a kid who was born from an HIV positive person. This can impact you on so many different levels. The same thing with the cancer data and the cancer research that we're learning more about. And the literacy. Literacy affects every single one of us, because if we don't know how to read and write, we are not going to be able to build one unified socialist Africa. If we do not know how to read and write, we are not going to be able to teach our children what socialism looks like in one unified socialist Africa. We are not going to be able to achieve what the All African People's Revolutionary Party has set out to do, because reading and writing are fundamental skills that we need to be able to advance our continent forward and to regain control of our resources, regain control of our land. All of that is tied to our ability to engage and how that will happen. And a lot of that is based on us being able to join organizations that are working for justice. Now, am I saying that once you join an organization that's working for justice, you won't be sick anymore? Absolutely not, because we live in a sick world. And so it's very hard to not have some type of health issue develop, because you're going to be in a position where you're going to have to deal with BS all day long. So you're going to have to find a way to protect your immune system in the process. And that is very hard. That is very, very hard to do. We talked in January about what it meant to get more rest and what it meant to have more stabilized bedtimes and things like that. Because living in a capitalist society, you're going to have to find a way to protect your body so that you don't let capitalism succumb to you and take over in a way that you won't be able to get yourself back. But it's very challenging. So no, I'm not saying that joining an organization won't keep you from getting sick. It's definitely going to happen. It's inevitable, because as I said, we live in a world that is sick. We live in a world where people don't take care of themselves. They don't wash their hands. They don't use soap when they wash their hands. And then we frequently touch surfaces that they also touched, and that's how germs get transmitted. But at the same time, if you join an organization that's working for justice, first of all, if you do need to work on your reading and writing skills, or if you feel intimidated about your reading and writing skills, then you're in a better position where you can build and develop those skills. Just like riding a bicycle, just like potty training a child, you have to take time to do that. That's going to take countless hours, countless devotion. That's going to take a lot of energy. You're going to have to work on it every single day, just like you would with any skill that you were trying to master. If you were learning how to teach a new course, or if you were studying how to become a parent, right? Maybe you've never been a parent before, and I doubt that one can truly study for that, but you all get where I'm going with this. If you're trying to prepare for trying something new for the first time in your life, the best way to do it is to practice it. And so joining an organization will help build those resources. It'll help build that muscle. Your brain is a muscle. And don't get me wrong, some of the readings that we've done in work study have been very difficult for me to grasp. My dad has talked about that. I see our comrade Mark on Zoom. I'm sure Mark can attest to that. We have read some pretty difficult things in our work study circles, but did I run away from it? Absolutely not. Because if anything, it was an opportunity to be vulnerable and to do my best to try to learn from that situation. So that's where the work study group comes in. That's where joining the organization is going to matter the most, because hopefully you're in an organization where it's with other people that you feel like you can trust, hopefully, and where you can be real with them and say, yo, this reading was really difficult for me. And then if they're honest with you, like you were trying to be with them, then they're probably going to say, yeah, I really, it was very dense. I didn't really get much out of it. And then we can all do the best we can to try to break it down, where we either reach out to a cadre member, somebody who's already familiar with the reading, or maybe we email our questions to somebody else who's already read the reading, but we find a way to deal with it. One time in our work study group, we decided we wanted to reread the sections, the 70 pages, because none of us really understood it. And so, again, like that's the importance of joining an organization, you all. That's why my dad said you shouldn't just be doing these readings by yourself. You're going to have to find a way to discuss them with other people, because if you don't, then you're not going to be in a position where you can fully grasp what the information is that you need to obtain. And I'm grateful for comrades like Kwame Nkrumah, because I just feel like he just was able to write like an angel, where I could just understand tremendously what he was saying. But not all of his books are easily digestible. Consciencism is very difficult, in my opinion. I only read one page and I struggled very much reading the one page. So we have to build up to that and continue to talk more about that. The other benefit of joining an organization that's working for justice is, as I've alluded to, you have to increase your political education. All of the data that we shared today was only because the AAPRP and work study has allowed me to develop my brain muscle, where I can open it up to be open to more information, and where I'm hungry to find more information. Because guess what? All of this information is going to be a unifying tool that I can use to build Mother Africa and to help us get our land back. That's the benefit of joining an organization that is working for justice. We always say join an organization working for justice. We never say join an organization, because you can join the most selfish organization that exists and you would not be doing anything to benefit Mother Africa. So you must understand that the intent of joining the organization is to benefit Mother Africa. If you identify as an African person, then you need to do something to help Mother Africa. She has done so much for you. It is your turn to do something for her. And so that means we can regain our resources, we can regain our land, and we can try to figure out what this new world is going to look like once we have control again. But we don't have that yet. The other benefits of joining an organization that are working for justice is we can help our comrades who are also seeking to obtain their control of their land back. So our indigenous people, our Asian descent people, even our Irish comrades, our European Irish comrades, they deserve to have their land back. So we have a lot of work to do, you all. This is not going to happen overnight, but it's up to us to figure out a way to do this, because we are the ones we've been waiting for. And I'll be honest with you, if you're not interested in helping Africa achieve socialism, then get out of our way, because the rest of us are dedicated to this work and it is exhausting. So allow us to take our rest, allow us to take care of ourselves, and then get out of our way when we're ready to get back in the ring, because we will continue to fight and we will win. We will win. That's the whole purpose of ALD, is to celebrate that we have already started winning. We just need to continue the work because we're not there yet. So again, we ask you to donate to the African Liberation Day event for 2023. We talk all the time about all the capitalist holidays and how they're pumping information down your throat to get you to spend more money. But ALD is going to feed your mind. It's going to feed your body. It's going to give you hope. If you have never, ever, ever watched our seminar on African Liberation Day, or if you've never participated in African Liberation Day via virtual or in person, you are truly missing out, and you should definitely prioritize the date on your calendar this year. I'm going to pass it back to my dad, and the next slide will actually have our ALD flyer so you can get more information. But I strongly encourage you all to continue to donate for African Liberation Day 2023. Consider joining an organization that is working for justice. I mean, I don't know why you haven't yet, because the status of our world has continued to be what it is. You saw the African team that got shot in what was it, Kansas City, just last weekend. So we know that Africans are still being gunned down. We know that indigenous people are still being gunned down. None of that has changed. And it doesn't matter how many African people are in political office, that will continue. So if you join an organization that's working for justice, then we actually have a chance of changing the conditions. But it's only going to start once we all understand that we all have that responsibility. Thank you so much. Asante Sana.
Ashe, obrigada. So before we close, I just wanted to highlight one element. The first slide where Shakura was talking, and it was a medical office in Cuba. They had a picture of Ernesto Che Guevara on the wall. And we always want to highlight our comrade, big brother Ernesto Che Guevara, because the capitalist propaganda mechanism is constantly working overtime to discredit him and any revolutionaries who are fighting for a better world. And so we just want to say that, his picture was up there is because he was a medical doctor. And much of the medical progress that socialist Cuba has instituted since 1959 has been widely inspired by his example that he provided in real life. If you haven't read his what he went through in the military the military engagements that he engaged in the Cuban Revolution, in the Congo and Central Africa, and in Bolivia, you should read about that, because he not only led those contingents from a military standpoint, but he provided medical care and assistance to the combatants in the field in each of those three countries, with obviously very limited materials in which to do so. So we're not trying to listen to anybody trying to discredit Ernesto Che Guevara. He went to Africa and risked his life for Africa and African people. The people criticizing him haven't done anything for African people or nothing for anybody in humanity. So to hell with you in your analysis. We determine who our heroes, heroines, and people that we look up to for inspiration will be. We don't need your influence. We're not listening to you. To hell with you and what you think about Ernesto Che Guevara and the Cuban Revolution. We are moving forward towards socialism, as we said in the beginning, for African people and for Pan-Africanists. One unified socialist Africa is not the end for us. It's just our contribution to the worldwide socialist movement and eventual world communism. So take that, put it in your bowl and eat it. And if you can't digest it, get some medicine, because it ain't gonna go away. It's just getting started. So we thank you for joining us today. We certainly thank you for coming today. And we just want to spend a moment and say that we'll be back next week, as always. The Ancestor's willing. Sunday, April 30th, we're going to do a program on revolutionary love. And the purpose of that program, you all, is to talk about how we build revolutionary consciousness within our families and in our friend circles. And we're going to be talking about some specific tactics and methods that you can use to infuse consciousness in your family and in the social circles that you exist in. Because so often we just think that we can be these revolutionaries, and then when we get around our social circles, we just turn that switch off and become reactionary, because we think that's the only way we can function within those circles. Or we go to the other extreme and become super revolutionary and do everything we can to alienate the people around us to the point where they don't even want to hear anything about revolutionary struggle. And they certainly don't want to see themselves getting involved in it and supporting it, because you have made it untenable for them. Like, why would they want to be someone that they perceive to be so negative and so anti-people? So what we're going to talk about next week is how not to be those people, but to be someone who lives by a set of revolutionary values and principles and raises your children and works with your partners or whatever your life situation is to develop those principles so that they become a way of life that is so consistent and so strong that people that see you are influenced by it. You don't have to tell them, I'm revolutionary. They already know that by how you behave and what you do. And that is what we're going to be talking about next week. So we certainly invite you to join us, same time, same place, for Revolutionary Love, how to develop revolutionary consciousness in your family and your social circles. And then we also want to ask you, because we have this picture campaign for African Liberation Day. African Liberation Day is all over the world, you all. It is an institution. That's what it is. And by institution, what we mean is that we are organizing African Liberation Day to combat, as Shakur said, the backward capitalist ideological institutions that they dominate. Here they come with their backward institutions. In another month or so, it'll be the 4th of July in this country, and all these imperialists and anti-human so-called holidays that they have that are designed to generate support within those of us that live in this backward cesspool for this backward decadent empire. So we have to have institutions that combat that on an ideological level. And African Liberation Day, Pan-African Women's Day, those types of activities. If you're Palestinian, Nakba Day, Indigenous Peoples Day, all of those types of institutions are designed to raise up the people's struggle. And so that's what we use African Liberation Day to do. So when we ask you to donate, that's why we're asking you to do that, because we know that the more people that can become aware of African Liberation Day, the more we can build upon the positive messaging that we can win, that we are winning. And that's what we want people to begin to think and see themselves in that regard. So we ask you to do a couple of things. One is help us with this campaign by spreading pictures. Take pictures of yourself. It's great if you wear white, because that's the international color. I know, a lot of people in this backward country, well, why wear white? How come we don't wear black? Well, again, we're Pan-Africanists. So our struggle is based on African values and culture. And I know that most people in the West don't know anything about that. Even people born in Africa don't necessarily know anything. Don't assume because they're born in Africa that they know it. Colonial education is worldwide. So we know that we are white because that's the color for occasions that we need to really focus and commemorate in our lives in Africa. So that's why we wear that, and we wear it all over the world. So if you have white, do that and take a picture in it. And if you don't have white, then that's okay too. Just take the picture anyway. It's great if you do it with our theme. Imperialism and neocolonialism must be destroyed. Africans stand ready for the revolution. That's our 2023 theme. Imperialism and neocolonialism must be destroyed. Africans stand ready for the revolution. So if you can take a picture with that theme, post it on your social media, keep doing it. That's a great way to raise consciousness among our people. It takes you not even 5 minutes to do that. I have an example on the screen from African Liberation Day here in occupied indigenous land and what they call California in 2019, the last time we had an on-the-ground manifestation here. And we'll be doing that again here this year, as well as Shakur said, we'll be doing it all over the world. We have several African Liberation Day manifestations that we are organizing, supporting throughout the African continent, of course. We have a couple in Azania, which is the African name for the colonial name you call South Africa. We have a couple of manifestations, commemorations taking place there. We'll be doing it in Nairobi, Kenya. We'll be doing it in Mari, Zimbabwe as well. And we have a couple of commemorations that are taking place throughout Ghana. We have commemoration in Senegal and Burkina Faso. And also, we are doing African Liberation Day throughout Europe, in London, and in Germany, Canada, and in various locations like Oakland, California, throughout this backward empire. So the funds that we ask to be raised are really to support our on-the-ground manifestations in Africa. That's what that money is for. So go to abetterworld.me and make as big a contribution as you can. You know, we have to, power begins at a conception, right? That's how it begins. So African Liberation Day provides a conception to our people of us being in power. So help us do that. And then take the picture as well, put it on your social media. You can send it in to uhuruliterature@gmail.com because we're compiling pictures. That would be wonderful. Please do that. Please do it. Please do that for our people and for our movement. And then APRP Forward Ever Shop, buy something there. If you bought something, buy something else. Keep buying there. Just like you go to Shell Oil every couple of days, go support African liberation and revolution every couple of days. And join the All African People's Revolutionary Party. If you're African, go to aprp-intl.org and join the APRP. And if you don't want to join the APRP, join the Black Alliance for Peace, the Uhuru Movement, the Malcolm X Grassroots Movement. Join any of those organizations and any others I didn't mention. Well, I don't want to join any one of them. Okay, that's fine. Or I'm not African and you're not talking to me. Okay, that's fine too. Then start today. As soon as this program ends in just a few short minutes, it's your responsibility to start I know more than those people. And so I'm going to start the Experts International Organization and organize for revolution or whatever you believe will bring about progress for the masses of people on the planet Earth. Start the I'm sick of them talking every Sunday organization. Start that. And we'll help you with the I'm sick of them talking organization because we just want humanity to be organized. We don't have that kind of ego. We don't have your kind of ego where we have to be the ones dictating what happens. We don't care who dictates it. We just want it to happen. So start the I Wish He'd Shut Up organization and we'll help you organize the I Wish He'd Shut Up organization. Support hoodcommunist.org. It's a blog that has revolutionary African voices. Stop watching CNN and CIA and support independent revolutionary African voices and spread the word about Hood Communist and this program and all the other programs there on your screen that the APRP sponsors. That's 5 different programs we sponsor. Spread the word. How the hell are we can't advertise. We're not Church's Chicken or Popeye's Chicken. We don't have their money to advertise on those backward TV stations. So we need word of mouth. So please help us. Come to African Liberation Day 2023. Support it. Donate to it. Buy my book, A Guide for Organizing Defense Against White Supremacist, Patriarchal, and Fascist Violence. A Guide for Organizing Defense Against White Supremacist, Patriarchal, and Fascist Violence. Well, I already bought the book. Well, then buy some more because all the proceeds go towards the revolution. Buy some more. It's only $8 and spread them around. Put them in those little bookcases they have on the streets. Put them in your local library. You know that the capitalist system is not trying to help me promote this book. So we need your help to get the word out. Say, I'm going to spend $8 a month and put this book somewhere. That's how we change the consciousness, you all. And if you don't want to support this book, my book, it's not an ego thing. Find another revolutionary book. Get Malcolm X Speaks and do the same thing. The point is that we have to start spreading these ideals beyond just us and the few people we know. That's how we build our movement. That's how we win. So we need people to be engaged in that process. So we thank you for joining us today. Please come back next Sunday. Please tell people, please be safe, be well, be positive. Don't listen to what these people say. The only thing wrong with you is that you live in a capitalist and imperialist world. Forward ever, backwards never. We are winning. Victory is on the horizons. Have a great rest of your Sunday evening.